Now let us study about the anterior wall of the middle ear. As I told you, there was a chorda tympani nerve exiting from the posterior canaliculus, entering into the cavity, and it exits out through the anterior canaliculus through the opening in the anterior wall of the middle ear. There is one more opening here. About this, I will talk about it later. In the lateralmost part, the superior opening is for the tendon, is for the tensor tympani muscle. You can see the tensor tympani muscle over here and the tendon going inside the middle ear cavity. And the lower opening is for the pharyngotympanic tube. This tube goes forwards and medially 30 degree towards and opens up in the pharynx. We will focus this and you can see how do they go it actually. Now let us see where is the internal carotid artery. Internal carotid artery is in the lower part of the anterior wall of the middle ear. Here, a sympathetic plexus around the internal carotid artery enters through the anterior wall of the middle ear and goes inside the cavity, and they form the plexus around the promontory. See, our internal carotid artery is exactly at this position where it is giving a branch which is entering into the anterior wall of the middle ear. Now let us study the inferior wall of the middle ear. This blue color one, whatever you are seeing, this is nothing but a jugular wall. This jugular wall, below it contains an internal jugular vein running downwards there, and there are parasympathetic branches from the jugular vein entering into the inferior wall of the middle ear, and they form a plexus around the promontory. The parasympathetic plexus from the jugular wall and the sympathetic from the internal carotid artery, both they join together to form a plexus around the promontory. Can you see this nerve arising from the inferior jugular foramen? And it is entering over here and passing through over the promontory and forming a plexus over here. And this one more nerve we talked about is the nerve arising from this internal jugular vein. And it is going to the anterior wall of the middle ear, entering into the middle ear cavity and going and forming a plexus over there.